just want to state before starting that I'll be going over the points in the same order that they were presented on the form we were given, just to make it easier for whoever's checking it off. You can check off as I go through them. And I think that's all I have to say. So, without further ado, hello, Miss Labuda.
Hello.
How are you doing today?
Good, how are you?
I'm doing wonderful. So, congratulations on your newborn baby. That's very exciting. If you don't mind, there's just some discharge teaching I just need to go over with you before we send you home. Is that okay?
Yes.
Matter of fact, let me grab this pamphlet. Here's a pamphlet for you. It's just some information if you have any extra questions off of what I'm explaining to you today. I'm gonna leave that right. I'll leave it right here on your bedside
Thank you.
for you to take home. All right, so I guess we'll just go ahead and start. Well, you just pushed a baby out, so the first thing we'll start off is teaching you about any sort of bleeding that or discharge that might be going on down there. It is normal to have a bit of bright red coloration at first of discharge, and then that'll be for the first few days, and then it'll move into a pinkish brown color of discharge for about day 4 from day 10, and then after following that, from day 10 to about week 6, you might just see some whitish yellow discharge. This is called lucia. And so what you want to look for typically is that there are no super large clots, like larger than a golf ball. That might be something of concern, or maybe like prolonged bleeding. It shouldn't be super odorous. If it is odorous, there might be a sign of possible infection that we might be concerned about. To manage this bleeding, you can use peri pads in your bed. Definitely keep an eye out for how much discharge is leaking onto the pad, and change those as needed. And just notify your provider if you have any sort of abnormalities with these with your discharge. Next, we can move on to peri-care. So just taking care of your vagina and just making sure it stays clean. So to do this, we can use a sitz bath to clean and relax as well. We can use a peri bottle after voiding. It's just a little bottle that you can squirt a little up there. Just make sure it gets completely clean because it's going to be very tender. We don't want to agitate it too much. Do that after voiding or defecating. You can use any pain medications that are prescribed to you. Make sure you do them as ordered. Don't do any less or any more. You definitely want to follow the provider's orders there. To lessen any sort of discomfort, you can tighten your buttocks while sitting. Avoid prolonged sitting. That might cause a little bit more pain. Laying on your side to relieve some of that pressure is a really good idea. Stay hydrated and use stool softeners to reduce strain down there while you're defecating, or for defecation, I should say. And if you have any hemorrhoids from giving birth, you know, any sort of ointment or suppositories that was prescribed to you by your doctor to help with that. And definitely keep an eye on those. We don't want them bleeding too much. That might be abnormal. If you are concerned, definitely notify your doctor. Breast care. So, as far as breastfeeding goes, specifically taking care of your breast during or postpartum with breastfeeding and everything, we want to do regular breastfeedings to prevent engorgement, which is just swelling of the breasts. They can become very tight and uncomfortable if you don't breastfeed. If you miss a breastfeeding, it might be a good idea to pump. And if you did miss a breastfeeding, make sure when you're breastfeeding and pumping that you do each side evenly, usually 10 to 15 minutes every 2 to 3 hours. Document breastfeedings if they're normal or unusual. Definitely feed the baby as they want, but make sure you try to push for some sort of routine that could be helpful for them. And to increase any sort of milk flow, just use warm compresses, like a damp, warm rag or towel. Make sure it's clean, of course. Make sure it's sanitary, but that can help increase milk flow from the breast, any sort of warm compress. Medications are a big thing. It is important that we don't take any sort of medications that might affect the baby, as we know that medications do go through breast milk and can affect your baby if you're breastfeeding. So take all your medications as ordered by your doctor. If you have any sort of questions about your medications, make sure you ask your pharmacist or your provider if you have any concerns or questions about side effects, how to take them, any sort of thing like that. Do continue to take your prenatal vitamin and iron. This is going to help your healing process. As we know, postpartum healing can take weeks. So any sort of extra nutrition or supplements that you can take, as far as what you've been taking and have been prescribed, can definitely help increase that healing process. That way we can get you on your feet a little faster. Drink plenty of water and use stool softeners, as I mentioned before, to reduce strain. You're going to have some constipation. Colace is one that postpartum women typically use. And if you have any sort of extra pain that your prescribed medicine isn't really helping, Tylenol and Motrin are always good options. You do not want to use aspirin, as this could increase your chances of hemorrhaging or anything like that, bleeding. We don't want that. Aspirin thins the blood, and that wouldn't be ideal, for a postpartum mama. As far as activity goes, this is definitely going to be based on your person specifically. So just know that. Go at your own pace. Get plenty of rest to start. Have a nutritious diet and stay hydrated. You can gradually return to normal activities as your body heals. Just introduce light activities. Start by walking around the bedroom, okay? And you can work your way up from there. Try to avoid lifting anything too heavily or pushing yourself too hard. Your first times getting up and getting around, definitely monitor your vital signs. If you notice your heart beating too fast, you're a little lightheaded, definitely sit back down. We don't want you falling. A lot of times mothers will attempt to get up before they're ready, and that couldn't be good. Then they might pass out, and that's not good for them. Definitely accept help from your family and any possible support groups that you might be interested in. I have some in there for you to look at, some support groups that might help you with like cooking or any sort of thing like that. Pregnant mothers should also intake an extra 500 calories a day, roughly, if they're breastfeeding. If they're not breastfeeding, they should continue with their diet prior to pregnancy. So that's your activity levels. Driving is a big one for mothers. Mothers want to get back on the roads. They're ready to get back to their jobs. They hate being in their bed all day. So as far as driving goes, your health should be semi-restored to normal before you attempt any sort of driving. Any C-section or peritoneal tears should be fully healed and not bleeding or any sort of infection or thing going on. Mothers should feel non-fatigued. You should feel back to mostly your normal operation, normal self. If you are experiencing any sort of anxiety or postpartum depression, do not drive. Notify your family. We don't want you on the road if you're having any sort of suicidal ideation related to postpartum depression. And just start with small trips. Go down the road to the gas station, drop your kids off at school. If you have any kids, of course, go to the grocery store, before taking any sort of long drives or any sort of extended drives like that. C-section or incisional care. So we want you to ambulate as early as possible. We don't want you to be laying in bed for extended periods of time. This could cause thrombophlebitis, which is just basically an infection in your veins from just prolonged sitting and laying in bed. That's not ideal. We can do leg exercises in bed, or we can just do some moderate walking every 2 to 4 hours to prevent that. Deep breathing is also essential. If you're in bed for a prolonged amount of time, you aren't using your full lung capacity, and then lungs that are not being used, they can definitely develop pneumonia and stuff like that. So we want you to definitely practice deep breathing, in, out, that kind of thing. Position as what is comfortable to you. You can use your prescribed analgesics for pain. Make sure you're using them as prescribed. Bracing with a pillow while coughing or straining is always a good idea, or just holding a pillow up to your abdomen is generally very comfortable for moms. And you can just clean that incision site with water and a mild soap, and you should definitely be changing that bandage on a daily basis, and definitely monitor for signs of infection. like extensive redness, pain, purulent discharge, like yellow discharge. That's not what we want to see. Definitely just be inspecting that bandage to see how much might be coming out. If it is a concern, notify your provider. Episiostomy care. So, once again, this is another type of incision. This is an incision, as you know, from your vagina to your rectum. It could either happen naturally because of too much pressure from birthing your child, or an incision made by the doctor to help get your baby out. So once again, this is an incision. It's kind of in a tough area as far as infection goes, because it's right there near your rectum and your vagina. You've got a lot going on down there as far as bacteria goes, so we definitely want to keep an eye out for infections. Same as the other incision. Just monitor for redness or a purulent discharge, discomfort, extended pain, warmth. You can use your PRN, your pain medicine as prescribed by your doctor, or any sort of topical anesthetics to help with pain as prescribed by your doctor. We can also use a sitz bath or peri bottle after using the restroom. We discussed those earlier. Peri pads, once again, for any sort of discharge. Witch hazel pads from the store can help decrease inflammation, calm the skin a little bit, the irritation. Definitely avoid douching or tampons during this time. We don't want to be using those right now. That could increase your chances of infection. And definitely just limit your activity. Don't strain yourself too hard. We don't want the incision to come back open or anything like that from strain. Infections, signs and symptoms of that you might be getting an infection. This is very important. Common infection sites are the uterine lining, perineal area, and surgical sites. So we want to be, as I said before, keeping an eye on these for any sort of redness, swelling, extra pain, purulent discharge, excessive discharge, possible bleeding or excessive bleeding. Know to provide your provider if these things appear, and yeah, obviously clean with mild soap, of course, and water as needed, and change out that bandage daily if you have a certain surgical site. Postpartum depression. These are more common in mothers who have a history of depression. Make your family members aware if you feel like you might be going through something. Don't neglect your support systems like your family. They are there for you, and let them know that this is a possibility, so they can be aware of any sort of change in behavior. Sleep hygiene is very important. I know you have a baby now, a whiny baby at that, right? But it's important that you get your hours of sleep as much as you can, okay, to help your mental health. There are support groups and medications available, so please don't hesitate to reach out and look at your book for support groups. Notify your doctor. We can get you started on medications that can help your depression. When to return to the doctor. So under normal circumstances, mothers should have multiple checkups within the first 12 weeks. That is generally the rule of thumb, several checkups in the first 12 weeks. And of course, more checkups would come for any sort of abnormalities you might be experiencing. So definitely notify your doctor and get a checkup going if you have any sort of concerns. And once again, don't be afraid to notify your doctor if you have any sort of concerns. There are several symptoms to look out for, and it is a long list. And once again, in your book, they will be noted as well. So this is a lot to look over or remember, but once again, it should be in your book here. Symptoms that require medical attention would include heavy vaginal bleeding or soaked peri pads, right? We talked about the peri pads earlier. Difficulty breathing, chest pain, single leg pain. That could be a sign that you're developing thrombophlebitis. That wouldn't be good. Any sort of depressive thoughts, extreme fatigue, persistent headache, vision changes, edema, swelling, abdominal pain, fever, foul smelling, logia, or any sort of psychotic symptoms would be very important to notify the doctor of. Right. Feeding. As far as breastfeeding your baby, as we said, breastfeeding each breast for 10 to 15 minutes every 2 to 3 hours. Pump if feedings are missed. When you're breastfeeding your baby, tickle its lips with your nipple until it decides to latch. You can try different feeding positions. And if you're having a lot of trouble with this, definitely we can get you in contact with a lactation consultant. It can be very different for different mothers, okay? Sometimes mothers have a hard time, sometimes mothers are just right on it, okay? And if you're having any trouble with that, it's not your fault, okay? It just happens. It's just something, it depends on each child. If you've had multiple children, you'll see that each child is gonna react differently to breastfeeding. It looks like your other child is here saying hello. So you have two children. Good to see the first child, and her name is
Luna.
Luna. Oh my goodness. Oh man. Your normal daily output for your baby will vary a little bit, but the first day newborns void typically 2 to 6 times at a total of 6 to 44 milliliters per day. After the first few days, normal voiding will begin to look as close to 5 to 25 times per day at 25 milliliters per day. 25 milliliters per kilogram per day, excuse me. Female newborns will have or may have blood or whitish discharge at the very beginning. This is normal. It has to do with their hormones and different changes as far as females go. Their baby's pee should be straw colored and almost odorless. If it's different, you might be overhydrating the baby or underhydrating the baby. If the pee is dark and a little bit more, has more of an odor, then that might be signs that the baby's not getting enough. If it's super clear, then it might be signs that you're overhydrating your baby. So just keep an eye out for your baby's urine color and odor. Umbilical cord care, of course, we have a bit of a healing situation down here for your baby because they have their umbilical cord cut off. So definitely monitor this area for signs of infection or excessive bleeding. And we want to promote healing as much as possible by keeping diapers clean and dry. We don't want any sort of liquid, urine on this healing area. Keep cord site clean and dry, as I said. Use mild soap and petroleum jelly. So mild soap and water to help clean it, and then you can coat it with a touch of petroleum jelly just to keep it from sticking to diapers, as well as just promote healing. And up until you're ready and it is healed, you can use the sponge bath method, so that way you're not fully submerging your baby in the water. You can use a sponge to kind of go around the area and leave it alone and not irritate it as much, okay? But after it's healed, you can definitely go to normal baths. Bathing and skincare for your baby. Make sure your baby body temperature is normalized before you attempt your first bath, because babies can be very sensitive to different temperature changes. Sponge bath technique until cord stump has healed, as we just spoke about. Use mild soap and water, and the water should be close to 98.6 degrees Fahrenheit. You can use a gentle moisturizer on your baby after the bath, and a barrier cream to prevent diaper rashes. Make sure you dry off your baby quickly. Don't leave them wet. As I said, they're very sensitive to different temperature changes, so leaving them wet might make them very, very cold and hypothermic. And of course, never, ever, under any circumstances, leave your baby alone in the bath. Next, we're going to be talking about shaken baby syndrome. So, this is head trauma for a baby being shaken rapidly or excessively. This typically happens when parents may become upset with the child because it's not sleeping, and in a moment of temper, shake the baby a little bit out of frustration is typically the situation. So to avoid that, we want to obviously soothe the baby as much as possible, keep them calm, so we can soothe the baby with skin-to-skin contact, swaddling the baby, keep having a calm environment, a quiet, calm environment, gentle handling, nesting, a cozy environment, as I said. Make sure when you're nesting them in their bed, make sure their bed is only has things that are improved as to not suffocate the baby. We'll talk about that next, but it's very important that when you're making them comfortable inside the crib, that you don't have anything that they could asphyxiate themselves with or suffocate. So approved items only there. Let baby bring their hands to their mouth. This is very comforting to them. Obviously, you can use a pacifier. You can gently rock or stroke them to calm them down, and then a soothing talk or singing always helps. I'm not much of a singer. Maybe a bit of humming could also do. And yeah, face-to-face contact with them can also calm them down. Next, we'll be talking about sleep safety. So SIDS is a common thing. It's sudden death of an otherwise healthy baby. It typically occurs in sleep. So this is something we want to watch out for. So when you're laying your baby to rest, place baby on their back. Don't have them on their tummy. Tummy time can be throughout the day, but when they're sleeping, we want them to be on their back so they don't suffocate. We want a semi-firm sleeping surface, so like an approved crib where they don't sink too far into it, but it's also soft enough so they're comfortable. It's a good idea to share a room with your baby so they're next to you while you're sleeping, so that way you can keep a closer eye on them. And while they're sleeping, we do not want them to have any sort of hat on their head or anything around their necks. Obviously, we want them to be in light clothing, not too heavy of clothing, so the danger is not there for them to suffocate on it. Also, breastfeeding is associated with a reduced risk for SIDS, which is a great thing. Thermoregulation of your baby, as we spoke about earlier, your baby is more sensitive to temperatures, cold or warm. So skin to skin contact can help keep them warm if they're cool. Dress newborn for appropriate climate. If it's a little warmer that day, maybe a lighter clothing. If it's a little hotter, we can do some thicker clothing, not too thick, obviously. You can use hats when they're not sleeping, so during the day, having a little boggin on their head can help keep them warm. We lose a lot of heat through our heads. Keep home comfortable at a warmer temperature, so not overly warm, obviously, but we don't want it too chilly in the house. We also don't want it too hot, just a nice, comfortable temperature. And then check your baby's body temperature often. So the way we want to do this is a reliable thermometer in their armpit. It's called an axillary temperature. Hold it there until it takes the proper temperature. Hold the baby's arm down a little bit gently while it's in between their armpit. And then a normal temperature reading for this would be 97.7 degrees Fahrenheit or 9 to 93.3 degrees Fahrenheit. Newborn jaundice is a common thing that can happen. It usually will occur within the first 2 to 3 days and last maybe 2 to 3 weeks. This can be due to substances inside the breast milk or incompatibility with the mother's blood groups or liver disorders. So there's breastfeeding jaundice and pathological jaundice. Make sure to avoid this. Keep an eye on your baby's eyes and skin for yellowing. If you do see any yellowing, definitely notify your provider and let them know so that way we can get you in for a checkup. Circumcision care. Keep area clean and perform diaper changes. We don't want them in soiled diapers often. Avoid using soap or baby wipes until the site is fully healed. Apply a small amount of petroleum jelly to prevent diaper from sticking to it, because that wouldn't be good. The sore sticks to your diaper. Take the diaper off, take the sore off with it. That's not ideal. Monitor for signs of infection or bleeding. We already talked about signs of infection and bleeding. It is normal for the site to look red and swollen and to have a little yellow crust for the first few days. And this site should heal within the first 7 to 10 days. Car seat safety. Obviously, we're going to be driving your baby around. So ensure your baby's driver's seat is in date. If you're using a used seat, I would push you to buy a brand new car seat that is up to safety standards, not borrowing a seat. But if you are borrowing a seat, do make sure it's in date. Ensure seat is up to standards for your baby's height and weight. Okay, babies are different sizes. They're going to need different types of car seats. Follow your manufacturer's instructions of your car seat to install the car seat. Make sure the car seat is flat against the seat and the straps are snug. Make sure your baby's chest strap is snug but not overly tight or overly loose. Regularly inspect your baby's car seat before you put them in the car seat. Just do that when you're putting them in is a good idea. Just make sure you didn't miss anything. Make sure your husband didn't miss anything. And that kind of thing. And then update your baby's car seat according to your baby's growth. They have new car seats now that follow your baby along through its entire journey through car seats, which is really nice. You can take pieces off of it and it follows them all the way through, which is very, very cool. So just make sure you're keeping updated to your baby's growth. Infection control. So obviously your baby can experience a lot of things. It does have a weaker immune system being so young, but performing frequent hand hygiene before handling your baby is a great idea. Wash your hands. You can't go wrong with washing your hands. Limit your visitors, maybe just the grandparents for the first couple weeks, and then we can have friends come in sometime later. It doesn't have to be overly strict, but you know, we just want to limit your baby's interactions with possible bacteria, infections, that kind of thing. Have all your visitors or anyone who's going to handle your baby wash their hands as well. No sick visitors. I cannot tell you, that might seem like an obvious thing, but you would be surprised with how often this may happen. If your family members are having any sort of signs of sickness, they do not need to be around your baby. Definitely advocate for your baby in that way. Even if it is family members, they should not be around your baby if they're sick. Breastfeeding will strengthen your baby's immune system, and make sure your baby has all vaccines and is up to date on their vaccines. Airway clearance. Help your baby with coughing as necessary. When you can, sit them up. When they're coughing, you can gently pat them on the back to help them cough up what they're coughing up. Watch for any sort of grunting, nasal flaring, or restlessness. This could be a sign that they're not breathing that well. Keep suction bulb near the crib or on you at all times, so that way you can suction secretions out of their mouth or nose as needed. Sit baby up to open airway if they're struggling to breathe, as I mentioned before. For babies that are unconscious, the first thing that you want to do is put them in a lateral position, so that way their tongue is not obstructing their airway. Don't want them on their back. Make sure your baby is hydrated to thin out secretions as much as possible, so that way your baby has a easier time coughing them up. And of course, throughout your baby's whole life, keep small choking hazards out of reach. That's going to go for your baby from now up until 8 years old. So just keep an eye on that. And then signs and symptoms of your baby having a possible infection. So unlike adults, when babies have an infection, they actually go hyperthermic, so their body temperature lowers, which is really interesting. So keep an eye on your baby's temperature, as we spoke about before. Poor feeding, decreased activity and responsiveness, irritability, excessive crying, seizure, tachycardia, or increased heart rate of your baby. Pallor, bluing of the skin at the lips and maybe the fingers. Increased rate of breathing, periods of no breathing, grunting, vomiting, diarrhea, decreased urine output, rash, or red spots on your baby could all be signs of infection. If you have any concerns, please notify your provider. We can get you in for a checkup. That is also a lot of that information about infections with newborns is in your book, so please do look over that when you get a chance. Symptoms that require immediate medical attention for your baby. These are very similar to the signs of infection, of course. So we're going to have increased rate of breathing, grunting, nasal flaring, retractions. So this is your baby's really trying to take a deep breath and they're using all their muscles to really try to breathe. Periods of breathing cessation, bluing of the mouth and the fingertips from lack of oxygen. Patchy skin, jaundice, which is the yellowing of the skin we talked about. Abdominal distension. Vomiting, no stool for more than 48 hours is concerning. No urine for over 24 hours is concerning. Severe hyper or hypothermia, so if your baby's getting too cold or too hot, it's definitely a situation we want to look out for. Prolonged irritability of your baby. If your baby's muscle tone is decreased. Extreme weight changes, like extreme weight loss or weight gain, is both concerning, so keep an eye on that. And lastly, your follow-up appointments for your baby are very important. So we would love to see your baby in the first 3 to 5 days. And then after that, in the first month, and then at 2 months old, 4 months old, 6 months old, 9 months old, and 12 months old. Those are the normal, if nothing's going wrong, checkups. Obviously, if you're having an extra concern or anything like that, notify your provider and we'll get you in as soon as we can. And that should be everything. So once again, as I said, I provided you that book. Do look over it as soon as you get the chance. If you have any concerns or any questions, do let us know. Notify your provider. And that should be it. So if you have any questions for me, I'd be glad to answer them now. If not, I will be on my way. Any questions, Miss Olivia?
No question.
All right. Well, I hope you have a wonderful rest of your day. And let us know if you need anything while you're still here. And congratulations on your baby. And it's not your first one, as we saw, so it should be smooth sailing. So thank you very much for your time, and have a wonderful rest of your day.
Thank you.
Thank you.